Shin splints, or MTSS, is a disorder that arises due to repetitive pressure on the lower legs when exercising. Shin splints are recognizable due to pains along the posterior medial tibial border in the lower leg, especially when running or jumping. This pain is not focused to one specific area of the lower leg, but instead extends around 5 centimeters along the sides of the shin bone. Although the exact injury mechanism of shin splints is not fully understood, the most likely cause of this syndrome comes from the inflammation of the connective tissues surrounding the tibia due to excess stress. The inflammation of the periosteum during exercise puts pressure on the shin bone, leading to sharp pains along the sides and front. MTSS is not an overly serious disorder and can be treated with rest, ice, compression, and stretching. However, shin splints can indicate the possibility of developing small bone fractures throughout the tibia that can get worse with repeated activity and may require surgery to fix, which is why MTSS should not be ignored.
Many athletic activities require running and jumping exercises, which can be a risk factor for shin splints, making it a very common sports injury. In fact, runners, dancers, and military groups report the highest number of cases of shin splints. Of all of the injuries in runners, shin splints account for 13 to 20%. In military groups, this number is from 4 to 35%. And in the dance community, approximately 20% of all dancers will develop shin splints at some point in their career. As a dancer myself, in my classes of 20 students, 3 of them had developed shin splints by the time they were 16 years old, and one of those students went on to develop stress fractures at 18 years old. The severity of shin splints can also vary based on differences in physique. Individuals who are overweight are more likely to develop MTSS due to the increased pressure on the tibia from their body mass, and women are more likely to develop stress fractures from the shin splints due to hormonal and biomechanical differences.
For our AntiSplint system, we chose to use a tech scan pressure sensor on the sole of the foot to record the pressure in the heel, and accelerometers on the shin, knee, and foot to track running form. The pressure sensor would measure the magnitude and quantity of impacts that the leg has taken. Once a maximal threshold of overall pressure is reached, the user will be alerted to take a break and stretch. The tracking data from the accelerometers would be used to suggest corrections to improper running form that may lead to shin splints. Near the ankle, we would place a main sensor unit to house the larger components of the sensor and technology needed for Bluetooth transmission to compatible devices. The device would be incorporated into compression tights to avoid impacting gait and to reduce soft tissue artifacts.
To test if our design can perform as expected, we have determined 3 methods of validation. Validation of the pressure sensor in the sole will consist of multiple low impacts using a drop tower and cadaveric lower leg. This method will allow our team to determine the correct level of sensitivity required for impact detection. Furthermore, we will be able to determine how many impacts the cadaver is able to withstand before suffering stress fractures. The accelerometers will be tested using human volunteers. This non-injurious test will consist of a prototype model being worn while the volunteer runs on a treadmill. Using this data, our team will be able to calibrate the accelerometers and pressure sensor properly. We will also be using a computational model to test a wide variety of factors that impact shin splints, allowing us to calibrate our system for any body type and athletic level.